Now that Giri has provided you with an overview of autism spectrum disorder, and Narelle has gone through the search for the final yield of clinical practice guidelines available for autism, I would like to focus specifically on one CPG, which is the New Zealand Autism Spectrum Disorder Guideline. Today I'll be providing you with a summary of critique of this CPG using the Appraisal of Guidelines for Research and Evaluation instrument tool, also known as the Agree-To tool. This clinical practice guideline was published in 2008 by the Ministries of Health and Education. The aim of this guideline is to provide the best evidence to improve the health, education, and social outcomes of patients with autism. Looking at Domain 1, the scope and purpose, the target population of this guideline was specified as children and adults with autism in New Zealand. The impact of this guideline on society is to help understand people with autism and to improve the services that are provided for ASD management. So, the expected benefit of implementing this guideline is clear. All the practice questions that were developed, along with the process of identifying and appraising the evidence to answer the questions, was provided. These were well written and divided according to the contributions of different work streams, as 5 different work streams wrote various parts of the guideline before being compiled together. These questions were specific and encompassed the target population, intervention, as well as the expected outcomes. Looking at stakeholder involvement, the guideline provided information regarding all members such as paediatricians, speech pathologists, and teachers that were involved in the development of the guideline, including what their area of expertise was, what institution they were from, and their geographical location and description of their role in the development process. The Maori and Pacific peoples' perspectives were also incorporated in this guideline, after a Maori advisory group was formed consisting of professionals, service providers, and parents who gave feedback about the guideline. However, detailed descriptions of how the information was gathered from this group was not included. Descriptions regarding the search strategy utilized by authors in this guideline were provided. As each of the 5 work streams utilized a different methodology, each work stream strategy was written. For example, the communication and literacy aspects of this guideline were compiled mainly by work stream 2. The search strategy they used was a search of the literature up until April 2004. Research was predominantly drawn from existing published guidelines and reviews of the literature. Moving on to the rigor of development, the search strategy described in the guideline did not include sufficient information for the search to be replicated. Omissions included exclusion criteria and specific elements of a PICO question. Although the search terms provided included the target population, the outcomes were not identified. Language exclusions of research studies were also not noted. The grading of evidence to support recommendations were appropriate and were user-friendly. However, limitations such as small sample sizes, insufficient outcome measures, and non-random allocation were not reported for the different types of studies. Rather, short, vague descriptors of the evidence gradings were provided. In the communication and literacy aspects of the guideline, writers did consider the potential benefits as well as risks based on research evidence from implementation of key recommendations. Looking at the clarity of presentation, a summary of all key recommendations in each section was clearly identifiable. Each recommendation was linked to evidence in the guideline. A well-written, clear and concise description was also available about a procedure for updating the guideline. It is stated that the guideline will be reviewed as new evidence is available through using a living guideline approach. In the applicability domain, some limitations were noted. The guideline, although provided key recommendations for assessment and management of individuals with ASD, did not incorporate sufficient information regarding the potential barriers as well as facilitators of implementing these in practice. The sources of funding for this guideline were provided. The Ministries of Health and Education both jointly funded development of this guideline. A statement outlining that the funding body did not influence the content of the guideline was not available. However, There was a clear statement which outlined that the contributors to the ASD guideline did not have any competing interests. But there was no mention of what competing interests may have been considered and methods of how these potential interests may have been sought. On a whole, this clinical practice guideline is a well-written and detailed guideline examining assessment, management and treatment of children and adults with ASD in New Zealand. The guideline has identifiable sections and is clear to the reader. It is specific to the intended users and key recommendations are easily identifiable in each section. Therefore, as a group, we would highly recommend this guideline for use. Now I will hand you over to Emily, who will be presenting one of the key recommendations from this CPG that we would like to implement into practice.